Hello, my name is Grace. I'm a nurse by profession. I've worked for about 35 years in different hospitals, in different departments. Now, when you're admitted in hospital, what do you expect? You expect to be given the correct treatment, the correct time, and the correct dosages. Now, for you, your part, what do the hospital expect out of you? The hospital expects you to tell the truth. When you're admitted, you give your age, you give the correct, the way you're feeling, you describe it correctly, and also you give us your correct age, and you give us your correct history to say, that is to say whether you've been admitted previously, whether you've been taking medicine previously, whether there are illnesses in your family, and also what kind of work you do, because it may be related to your disease. Now, when you come to the hospital, we expect you to respect the staffs, to respect other patients, and the same is adhered to you. And then when you also go to hospital, there are policies. Each hospital has its own rules. So they expect you to follow the rules. There's a time for medicine, there's a time you have to take a bath, there's a time the doctors come to see you, there are times that you have visitors. Now, your visitors are expected to come at a specific time. That is the hospital rule, and you're expected to follow it. Now, there are hospitals that do not allow food because that is their policy, because they are providing you with the food. In case you are unable to take that food, you can talk to their dietitian, who is able to guide you on what you eat. And there are also many reasons why they do not allow food from home or outside food, because sometimes it may compromise your treatment or it may compromise your healing. So, and there are specific diets for specific people, so that is why they ask you no food in hospital. Now, this also you expect when they are giving you the medicine, they should give you at the correct medicine, the correct dose, the correct time, and the correct area, because an injection you cannot be given in the mouth. So this is the way things are done in the hospital. Then another thing that when you're in hospital, they're supposed to keep you safe. Safety is a must because you are under their care. So if there's a risk, they're supposed to protect you. The hospital is supposed to protect you from any risks. You as the person, please do not go with any valuables, because they also expect you to take care of your valuables. So leave them at home. If you have gold watches, gold rings, please do not go with them to hospital, because when they get lost, they will not be responsible for your valuables. Even some of them ask you to go home with your clothes. You wear the hospital gowns and the hospital uniform. So that is the expectation of the hospital, and that is what most hospitals operate under. And also when they are giving you, they give you their cups, they give you their plates, they give them the whatever. They don't expect you to come with things from home, even blankets and all that. Most hospitals provide that. So if you're feeling cold, ask for an extra blanket. They will provide it. If you're in pain, ask for a painkiller. Do not combine medicine from home to what you're taking. And you only take the prescribed medicine that you're given. So if you're taking other medicines, you need to inform the doctor in case they react with what you're taking. And your medicine should not be shared with the other patients, because each patient has their own medicine and they have their own illnesses. So it is not advisable to give your medicine to the other patients, because you are also a patient.